Measuring the vision in children can be more complicated. All testing should be carried out in a well-lit, quiet area to minimise distractions for the child. Until a child is 6 months old, vision is assessed as the ability to fixate and follow an object, such as a brightly coloured toy or light. Each eye should be tested separately and the reaction to occlusion noted. If there is equal objection to occlusion of either eye, this suggests that vision is similar in both eyes. If there is more objection to occlusion of one eye than the other, this suggests that there is a difference in vision between the two eyes. From approximately 8 months, the ability of a child to see sweets and cake decorations gives an estimation of their vision. Each eye should be tested separately. If the child can see the small object, he will reach out for it. If he cannot see it, he will feel for it. Between 6 months and 3 years, preferential looking tests, if available, can also be used. An example of this is the Cardiff card test. These tests are based on the idea that a child prefers to look at a picture rather than a plain card. The pictures are graded using the same scale as the Snellen's chart and are printed on the back of the cards. The card is presented at 1 metre or 50 centimetres. An object is either at the top or the bottom of the card, with the position initially unknown to the examiner, and the direction of the child's gaze is noted. When the examiner is unable to detect the position of the object from the child's gaze, the child is assumed not to have seen the object. The size of the smallest picture seen is recorded. From the age of 2, matching tests can be performed with the child matching a picture or shape positioned 3 metres away with those on a card in their hand. Initially, charts with single pictures of different sizes are used. K pictures or LEA symbols are examples of this type of test. The Sonksen acuity test is similar to the Snellen acuity test with a line of letters to match. The size of the smallest letter or symbol is recorded. The methods that have been described for assessing vision in children can also be used and adapted for adults with learning disabilities. The measurement of visual acuity is important in determining not only diagnosis and the possible effect of treatment, but also how visually disabled a patient is and what the likely effect this will have on their life. It should be measured carefully to make these simple tests as accurate and useful as possible.